we're gonna go live with Lisa in La Jolla, and oh, and here we are. Hello.
Hello. Hi, Dr. Rollins.
Hi. So,
Hi.
how's it going in there?
It's going awesome. How are you?
Wonderful. I can't wait to see what's going on.
Hi, Lisa.
Hey.
Hello.
Hi, Dr. Rollins.
Hello, Lisa.
Hi.
Hi. I want to see you. Can you? Okay. There we go. Hi. Nice to meet you.
Nice to meet you too.
So, I heard you're having your legs done. Tell me exactly what you're doing.
They're doing my thighs, my saddlebags, my inner thighs, my banana rolls, and my knees.
We call that full leg.
Yes.
Perfect. So that's at Elite. We call that full legs. And usually, when you remodel the kitchen, you remodel the bathroom. So neighboring areas tend to get done together. Like usually, if you do inner thighs, you do knees. So, are you getting it done right now?
Yes. As we speak.
Can we watch for a minute?
Definitely.
Let's take a look. So this is Dr. Nallery. Hello.
Hi.
Hi. Thank you for sharing your procedure with us. We really appreciate it.
Absolutely. Thank you for having us on live.
Yeah. So you can just go ahead and operate, and we'll kind of pan back and forth. So you can do your thing. Thank you. So she's getting it. Let's look at her bucket. Can you show how much fat she's had out already?
Yeah.
Okay.
About 300 or 400.
Oh, nice. So that's her bucket there. And if you guys notice, there's no red in there. It's almost all yellow. So that's a special thing about AirSculpt. And that shows we're just taking out fat and we're not hurting her muscle or her skin. So Lisa, let's talk Lisa. Lisa, so tell me about your journey. How did you end up getting AirSculpt, and how did you hear about us, etc.?
Sure. So I've tried everything under the sun that has been labeled as, non-invasive. So I tried sculpture, I tried cryoskin, and I've even tried fascia blasting for pretty much insignificant to minimal results. I think the results were more in my head than they were actually physical. And so I was just Googling for more options available, and then I saw Elite, and I immediately tried to look for women that looked like me with my body shape, etc., and tried to see the before and after, because I didn't want to look like completely different against, I was curvy before curves were the in thing, and so I didn't want to lose the curves. And I saw quite a few photos of women that had legs like mine and their knees, etc., and so I decided to give it a call.
That's something really important at Elite. Is we really pride ourselves on everything is about results, right? So we want to show as many results as our patients will allow, because my hope is that our patients can see someone in our before and after gallery that they can relate to. So we try to have all kinds of people with all kinds of every possible area, so that you can actually have a good idea of what to expect. I think expectations are so important. So how does it feel right now that you're having it done?
Right now, I'm just envisioning the shorts that I'll be wearing that I haven't worn for over 10 years.
You will. I'm promising you that right now, live. So you will.
Yes. And I've been able to wear shorts, but just not comfortably or confidently. So I think that that's what I'm most looking forward to.
Okay, shorts.
Yeah.
But does it hurt right now? You're actually getting
fat. It doesn't really hurt. It's just like the buzzing sensation is a little weird.
You should feel my patient.
Yeah, and the fascia blasting is 10 times worse than this.
and 0 times as effective. So,
exactly.
Like he's doing your knee right now, and your knee is actually like you have no knee fat already because it's in the bucket. Can you see your bucket?
Yeah, I'm looking at it, and I can't believe how much has come out already.
Isn't that weird?
The knees has been my greatest insecurity.
A lot of patients hate when their knees touch. It really bothers them. And it's such a quick, easy area. I mean, knees take like 5 minutes a piece. And it can really make someone so much more confident and just more comfortable in their own skin. So
I want to get knee definition back.
I love knees. And so there you go. Those are Lisa's knees going in the bucket, gone forever.
Okay.
So, and what's it like being awake?
It actually reduces my anxiety, believe it or not, because I feel like I'm in control of what's happening. I can talk and ask questions as they're doing it.
First of all, being awake is safer, in my opinion. And but it doesn't. Being awake doesn't limit your results in any way. In any way, we can take out just as much if you were awake or asleep. And I think it's important to feel like you have some control of the situation. You get to interact with the staff, and you actually get to help the doctor. If your surgeon wants you to move your leg, you can move your leg, right?
Yeah.
You're not like a sack of potatoes, and you can actually help create the result that you want, and watch and critique it. So I love that. Actually, after you do your outer thigh, it's really cool if you can, Dr. Nallery, if you can put a sterile glove on her hand and so she can feel her new outer thigh on the table, that would be amazing. What would you tell friends and family about AirSculpt if they
Well,
ask?
I've been telling friends and family before I even got it done that I was excited, and that it seems like, based on the Instagram stories and the pictures, it seems like really transformative change that you see right away. You know,
Yeah.
I've had friends that have had other more invasive surgeries done, and they've had, you know, balls hanging from them for weeks on end, capturing fluid, and they never got to see the immediate results right away. So I've been telling folks, based on all the testimonials, that, you know, I will take a picture of my legs in a week, and we'll be able to see the difference. We don't have to wait for it.
Lisa, we're gonna let you put a glove on.
Okay.
You can feel your new thigh. So come and take a feel down here. Yeah, you can sit up just
Just
a
sit
little
up?
bit, and you can see that this area is much lower now
Yeah.
compared to this side that we
I
haven't
can
worked
actually
on.
see my knee.
Yeah.
Yeah.
This area that we got reduced.
Yeah.
You
This
can
is
feel
huge.
the other side too.
Yeah, I can definitely, I can literally see my knee with no mound hiding
Isn't
it.
that amazing?
That is awesome.
Behind me, we have a picture of Lisa. We did Lisa's inner thigh, knee, and outer thigh, what we call full legs, 2 weeks ago. And I am overjoyed to show you her results. So obviously this is her before, and we've got, here's her saddlebags. Okay, we have saddlebags, we have inner thigh, we have knee. So what you can see, we put arrows to show the result. Not that you can't see it very obviously, but she was so upset about her outer thigh. It was a really big deal to her because it's been there her whole life basically. And 2 weeks later, it's absolutely gone, right? And it's a natural, smooth result. You know, what I want a patient's after to look like is they never had the problem area. And that's what we've achieved here with Lisa. I think it's an absolutely gorgeous result. And I'm so proud to be the CEO of this company because, I mean, we're just changing her life. Look at the front. I mean, it's beautiful. So this is what we do. This is what AirSculpt can do. We did her live, and here she is 2 weeks later. So congratulations, Lisa, and thank you so much for sharing this journey with us. The other part to talk about is she's only going to look better. So a couple months from now, she's going to level up again. So this is the beginning of your result, Lisa, and everyone watching. It's not the end, but what's important is what a dramatic change in 2 weeks. That's a beautiful thing. So I love showing this. It's my favorite part of my job.